Cancer changes everything. The diagnosis alone strikes fear in almost everyone. And the standard treatments, while life-saving, can take a tremendous toll on the body. But what if there were a way to fight cancer and support your immune system naturally, powerfully, and without harming healthy tissue? Welcome to the Aging Well podcast, where we explore the science, stories, and strategies behind living a longer, healthier, and more purposeful life. I am your host, Dr. Jeff Armstrong, an exercise physiologist with a passion for making science simple and life better as we age. My guest is Dr. Jeff Gross, founder of ReCELLebrate, and a leader in regenerative stem cell and exosome medicine. With decades of experience transitioning from traditional neurosurgery to cutting-edge cellular therapies, Dr. Gross is pioneering the use of activated natural killer cell-derived exosomes, a groundbreaking approach offering hope for cancer treatment, immune system rejuvenation, and even longevity. Together, we'll explore how these tiny cellular messengers are rewriting the future of medicine and aging well. The Aging Well podcast encourages informed decision-making and always consult your physician and scientific literature when making decisions about your health. Dr. Gross, welcome to the Aging Well podcast. Let's start by having you tell us a little bit about yourself, how you made the move from neurological surgery and biomechanics to anti-aging, regenerative medicine, and exosomes.
Great. And thank you for having me. It's great to meet you and share and educate you and your audience with this. But I was practicing traditional neurosurgery. I have a spine fellowship. That's the biomechanics piece. And I treated people with neck and back problems for most of my career, and I still do. There was a gap. There was a missing element, and that missing element was something short of surgery. So a lot of patients would have therapies, and they would have maybe epidural injections or other spine injections. And then some of those patients would get better, and some wouldn't. And the ones that wouldn't would come to me and say, I'm just still struggling. Those things aren't helping enough. Maybe they help temporarily or a little bit, but not enough. And they'd say, well, what else you got, doc? And I say, well, the next thing on the menu is surgery. And they're, oh, I'm not ready for that. And I'd say, okay, great, because I didn't want to offer it to you unless you absolutely had to have it. And then they'd say, well, what else you got? You got lasers, you got crystals, you got, meditation, you got acupuncture. We try some of these different things, but enough people said, what about the stem cell stuff? I hear that's cool. Let's do that. And luckily, chance favors the prepared mind. And I do have undergraduate background in biochemistry, molecular cell biology, which is the field that covers cells, So I said, I miss that stuff. And I bet you there have been some updates since I was in that education. Let's go back. And instead of going to the annual neurosurgery conferences where a bunch of stuffy guys in bow ties are patting themselves on the back for doing the same old thing for decades, I actually started going to stem cell conferences, and I re-educated and retrained in an effort to add that as a new tool as part of what I do. But it has blossomed into so much more than just adding stem cells or stem cell type biologics for the spine. I am almost doing this full time. We look at other joints, inflammatory issues, all kinds of things. And hopefully we'll expand on that here.
Oh, we definitely will, because I'm really excited about this. And I'm an exercise scientist. My area is exercise physiology. Never been quite as good with really on the micro level. I'm much more on the more gross level. But I did most of my PhD. I was mentored by Dr. Michael Flynn, who was very much into exercise immunology. And so, when we talk about natural killer cells and all that kind of stuff, I get kind of geeked out over it.
Yeah.
So for those who are a bit more unfamiliar, what exactly are natural killer cells and what role did they play in our immune system?
So the natural killer cells was a newer project superimposed on my regenerative medicine sort of reemergence here, my practice version 2.0. But what had happened was we were doing all kinds of things with stem cell signals like exosomes and growth factors. But it turns out we didn't have anything in that realm that was specific for cancer. And, I couldn't not people with cancer if I could. So I've been, geeking out, nerding out. I read a lot of literature every day as part of my routine. So I I started reading about immunotherapy more and more, which I had participated in over the years. And it became clear that there's a part of our immune system called the natural killer cell, white cell. It's part of the white system. About 1% of our white blood cells are these natural killer cells, and they're very cool. They are like a security system that go around the body, and they identify and selectively remove abnormal cells. So that could be an infected cell, like a parasite infected cell. It could be a senescent cell, which is also called a zombie cell, which is sort of an old cell. It's divided too many times. It's boggy, blogged, full of gunk and oxidation. It leaks these things. It takes up resources, but it's not good for the system. And the more of these you have, the physiologically or biologically older your body is. So that's why they're called senescent, which has the same root as senile or old. So it'll remove those, but it also turns out it removes cancer cells that are abnormal. And during our life, we actually make accidental cancer cells, gene mutations, whatever, different reasons. We make them, but our body removes them. And this is how we remove them, natural killer cells. Well, if you look at a population of patients with cancer, it turns out that across the board, their natural killer cell function and quantity both are diminished. So I'm not saying that's necessarily the cause. They lose this natural killer cell function that allowed the cancer to happen, but it could be. But certainly it's correlated. So it's interesting. So I thought, well, geez, if you could give back that natural killer cell function or count, could you treat the cancer? And it turns out I wasn't the first to think about this. Many have, and I poured into the research and I studied it. And because most of the regenerative medicine I deal with, aside from this, deals with cell-derived vesicles called exosomes, I found out that natural killer cells do their work, kill selectively these abnormal cells, not hurting our normal cells, through their own specialized natural killer cell exosomes. I thought, great, I'll just get some of those and we've got something to go on here. Well, it turns out it wasn't that easy to get these because they're very hard to acquire enough natural killer cells and then have them produce these vesicles, these exosomes. So, and the exosomes are very neutral to the body, so you don't really reject them. Whereas if you're getting someone else's natural killer cells, you could have a rejection response. So the exosomes are more ideal. They also travel through tissues better. And I studied the research, and there are quite a few publications on this. Both injecting tumors and also using these systemically in an intravenous delivery. And we finally, earlier this year, got our hands on some natural killer cell limited doses, the exosomes, and have been using them to help people with an alternative or an augmentative approach to treating cancer. Sorry for the long answer, but now you got it.
No such thing as a long answer. You didn't ramble on or anything. That was really good and informative. And I think it's really cool. The term zombie cell sounds so much better than senescent cells. Maybe it's a bit of the ageist in me or something like that. But so how are these senescent or zombie cells, and you talked about them with cancer, but how important are they with aging research?
Yeah. So there's a great paper, and this is before they had the exosomes, but a great paper where they actually did natural killer cell augmentative treatment, just the cells for people who didn't have cancer. They were just regular people like you and me. And they were able to show a reduced set of age markers. And there are certain age markers related to these zombie cells. Beta-galactosidase, for those of you who really want to geek out with us, that's the enzyme and that's leaky from these senescent zombie cells. So they showed a reduction in beta-galactosidase and other markers that lasted up to 2 years after an infusion of these natural killer cells. So what we're doing now is sort of an extension of that. We can do it for, we'll call it anti-aging biology. Although we have so few doses, I'm really reserving those currently for patients with cancer, because we've got to help those.
So no billionaires are reaching out to you saying, "Hey, come on, I'll pay you some money. Give me, some of these zombie killing cells or exosomes that you have."
No, they're not.
That's good.
And honestly, I would hopefully we have the stem cell derived exosomes which also have incredible anti-aging properties. So we have alternatives and this is priced right. This isn't for the billionaires per se. It's for almost everyone. And this day and age, you've got to take care of yourself proactively. It's nothing your health insurance is going to do for you.
Right. And actually, when we kind of dive into natural killer cells a little bit more, we know that if you're exercising and you are healthy and eating right, your natural killer cell activity should be doing its own job. But you're talking about situations where people have reduced natural killer cells and are battling something as horrible as cancer.
Yeah, and you make a great point. You can stimulate your own natural killer cells. Really good glutathione and transfer factor supplements can do that for you. Fasting, other forms of hormesis like hot sauna exposure, cold plunge, high intensity exercise, really getting those muscles to release the myokines, the growth factors. All of these have been known to stimulate both your own stem cell release and your natural killer cell function. Those sort of go hand in hand. Thank you for pointing that out.
Yeah, and so if we do all that stuff on the front end, then it kind of reduces the need for you to have to treat patients for cancer, because, oftentimes we think we got to deal with treating cancer through all these different methods, but the best way to treat it is to prevent it in the first place.
Yes, and for those of you listening to this and not watching the video, I'm nodding very, very eagerly up and down. Yes, yes, and yes.
So how do natural killer cell derived exosomes work to target cancer and zombie cells? And this probably seems obvious, but why is this approach considered so groundbreaking?
Well, I'm going to take those in reverse, if that's okay. It's groundbreaking because it was so hard to accumulate the natural killer cell exosomes in the first place. And giving natural killer cells has challenges because, again, you can reject them. And to get your own requires a lot of lab work. You have to harvest your white cells, separate out the natural killer cells, which is very labor intensive, and then grow them in a petri dish so they expand, and you have to encourage them to do that and then give them back. There's a lot of work involved. The exosomes are an off-the-shelf therapy from the natural killer cells. And then how do they work? Their exosomes contain two enzymes that are very particular, perforin and I think granzyme. If I'm wrong, someone will correct me here in the show notes or comments. But perforin actually helps perforate or poke holes in the bad cell so it can rupture. We call that lyse. It can lyse open, and it can be destroyed that way. Meanwhile, they do not affect these NK or natural killer cell exosomes do not hurt or affect our normal cells. So they are very specific. They're like a cruise missile. They go right to the target.
They are such a cool cell. It's like one of my favorite structures or concepts in cellular biology and exercise physiology. So I'm going to be geeking out through this whole conversation. So
well, I've got plenty of time. We could go for hours.
I'm sure you have plenty of information too. So when we talk about activated natural killer cell exosome therapy, how is that different? And I think the differences are probably a little bit more obvious, but how is it potentially safer than chemotherapy and radiation, which are the more traditional treatments for cancer?
Well, in answering this, I'm not necessarily saying that chemotherapy and radiation are wrong, right, but they certainly have their downsides. Both of them are poisonous to our cells. That's the strategy by which they work. The goal is to poison the cancer faster than we kill ourselves, or kill our cell populations. Whereas the natural killer cell exosomes don't have any of that downside. We've never seen a side effect from using them, and none have been reported in the literature. So far, they seem to be apparently safer. I'm not allowed to make that claim yet because we're not allowed to make marketing claims about safety and efficacy. But anecdotally, it looks like we haven't had any safety issues so far.
And it would seem like it'd be, hypothetically, if I have to say it that way, more comfortable for the cancer patient than going through chemotherapy, where you're not losing hair, you're not getting nauseous and vomiting and all that kind of stuff.
Right. Yeah. Those side effects are common with most chemotherapy and certainly radiation and tissue damage and that kind of thing. So we're using them to help address cancer for that reason. We're also using them for people that are high risk for cancer who want to take action, do something. So maybe you have a BRCA gene mutation and your family history is positive for cancer and you want to do something. And then we have people who've already been treated for cancer in a traditional way, and they're in remission, and they're looking at statistics saying that, they've got a good chance of being in remission for 5 years, but they want to push that to 10 and 15 and 20 years, and we want to push it for them. So these might be strategies to try. And again, we can't make any claims, but I can show you literature. I can show individual patients literature, medical publications that have shown benefits.
If you're enjoying the Aging Well podcast, be sure to like, subscribe, or follow on your favorite platform so you will never miss an episode. And if you find our conversations helpful, please share the podcast with a friend, because aging is something we're all doing and we're better at doing it together. And support our guests in this podcast financially by visiting the affiliate links in the episode description below, and use the links or codes provided for discounts on products we have vetted and feel comfortable recommending to our valued viewers and listeners. Thank you, and now back to the podcast. Yeah, I'm the type of person, I'm definitely into like the literature and, prove it to me that it's going to work. But there's so much of kind of some of the natural, I shouldn't say natural, but the Western medicine pharmaceuticals that we use to treat things that, you kind of look at it and say, how effective can that really be? Is that the best treatment? And then there's things, like what you're talking about, that if you know your basic physiology and biology, it's like, that makes perfect sense. That's the most logical approach, and it's going to be a very safe approach. How can it not work?
I agree. And look, we all notice there's a bit of revisionist thinking now and going back to logic and looking at medications and vaccines and things that have been on the market that may, A, not be doing what we want them to do, and B, may be causing harm. So we saw that yesterday in the news. I don't know when this will air, everybody, but we're recording this a day after or 2 days after Tylenol is now being warned not to be used in pregnant women because it seems to be linked to autism. Now, I haven't studied that literature, so I don't know, but it's enough that a warning should be out there.
Yeah. And to me, almost any chemical that you bring into your body that's foreign to your body during pregnancy increases the risk of some harm to the fetus. It's just not natural. But something like NK cells and their exosomes, there's nothing unnatural about that. They're in your body, maybe not in the quantity that you want them to be. And by raising them to a quantity strong enough to do their job much more effectively. It's like, not to sound political here, but, we went through that whole period of, defunding the police. And then we found out when we defund the police and there's fewer police on the street, there's going to be more crime.
Right.
And so, you want to fight crime, having a greater police presence on the street is going to reduce that. And if you think of a natural killer cells in the same way, having more natural killer cells, even if there's nothing for them to fight, they're just cruising along, waving to the crowd and being polite and not hurting anything. But if there's enough of them, and then there is a group of cells in the body that become cancerous, they're on alert and they're like, hey, and they're able to call them all in. And it just is, I don't know. I geek out of the NK cells. They're my favorite.
It's a great analogy. A great analogy you just pointed out. So I love that. Yeah. So this is a little more police presence in the biology for sure.
Right. And so how does the therapy selectively destroy cancer cells without harming healthy tissues? And I kind of know the answer, but the listeners might not.
Nature's figured this out. There are a couple CD or cell receptor mechanisms that help the NK cells identify where to deliver exosomes. And then when we give those exosomes, they are selective for their targets. So the biology is done for us. It's natural, and it's nothing that's been designed, in a lab. It's nature and evolution have created that. Divine intervention, who knows? But it's a perfect.
Yeah, it's kind of like I mean, I can go into some analogies that might not suit people's tastes presently, but just thinking simply, if like all your cells in your body are wearing a red T-shirt, the NK cells are looking for somebody in a blue T-shirt, and they're going to kick them out. So it's pretty simple, but just amazing aspect of our physiology.
Yeah, and we have it innately. Excuse me, it's part of us. And but some people need a little boost, and that's where regenerative medicine comes in, and that's the basis of almost everything we're doing now. At least in my clinic, I haven't abandoned traditional medicine, but it's not always the first line of offering.
I kind of don't like that word traditional medicine, because that just means we're not thinking a bigger picture. We're not thinking outside the box. We're just relying on, you really think traditional medicine is kind of leeches and bloodletting and that kind of stuff.
And we're back to the leeches now, because if you think about bloodletting, it's a great way to stimulate your bone marrow to put out more stem cells. So I'm sure that the barbers of the day who were doing that didn't know how it was working, but it probably did help. But you're right. We should rebrand. We'll call it, typical Western medicine, the stuff they pump out in medical school where I attended, and others are attending still. And that's more of the cookbook, Kool-Aid, knee-jerk, responsive medicine, not logical, preventative, biological medicine. And the word logic is right in biology, biological, right? Too bad so many people aren't using it.
So this is the Aging Well podcast. So we want to kind of tie this into aging a little bit more. And obviously, if you don't get cancer, you are able to age.
Right. You can live longer and age gracefully and longer. So we talk about, health span. We talk about a healthy aging, because I think the best things we advise our people, our clients to do is first and foremost, because people ask, what's the one thing you would say to someone to age well? It would be to support your muscle mass, to exercise with intention, strategically. You don't have to hurt yourself, but we like high intensity interval stuff. We like heavy lifting. It doesn't need to be weight that hurts you. It could be resistance bands. It could be all kinds of things, because if you support your muscle mass, you'll live longer. That's correlated. If you use your muscles in a weight-bearing way, you support your bone density. And your bone densities are your main repository of your stem cells, which help replace, renew, restore. So by using your muscles, you're helping your bones and your muscle mass, all of which contribute to longevity. So the single simplest thing you can do would be a really good guided, exercise regimen.
And kind of back to the NK cells and the rest of the immune system, if you're increasing your circulation, even if you have, again, fewer police, in the system, the more often they're able to circle the block, the better they're going to be able to do their job. And so we're kind of just getting those cells moving through more, exposing them to the unhealthy cells.
Yeah, so you got to build your muscle system. And remember, you have two hearts, one in your chest and the one in your calves. So you got to have good legs. So you got to have leg day. You got to have the weight bearing. So we're big on that. And you can be in your 80s and 90s and do stuff, and you don't have to hurt yourself. Just, someone can guide you and give you a good program, and it doesn't have to take all day, and it doesn't have to be free weights, because, there are risks of injuries at certain points, and there are ways, to stay more pliable and prevent injury, and a good flexibility add on to that is welcomed, because the more you bend before you break, the less you break. Right. So
that's true.
Just like any, if you're taking physics, you take a piece of plastic, you bend, eventually it fails. Well, it's the same with our tendons and our ligaments. So we got to get them flexible. You got to keep them moistened. You got to have all the good stuff in them. I do believe in good nutrition and protein. Most of us are not getting enough protein to maintain muscle mass, even if you're exercising. So you really have to feed your muscles the building blocks. And, there are strategic ways we call it biohack that system. And generally that's through use of peptides, which are a really interesting regenerative and, anti-aging hack or technique. You won't find this in your regular doctor's office except for insulin and GLP. Both are peptides. But right. there are we'll call them cutting edge peptides that you can take for healing, for collagen production, for stimulating the body to act more in a youthful state. And I think the next most important thing would be optimal hormone replacement, both men and women. I know there's a bunch of myths out there. A lot of them have been debunked, but this is an absolute necessity if you want to live long and be healthy.
Okay, so can you share any success stories or patient outcomes that illustrate the power of this new therapy?
Well, I can tell you many based on the stem cell derived exosomes that we do for a lot of the joint and spine work that I do. And we've only had the NK exosomes now for about 7 months. So, but I have been offering the people we do IV therapy. I've had a man with masses in his neck, a tumor that was spreading to both sides. And we did IV, and I was able, because they were at the surface, I just injected these masses. And he had some that were so big they were in his tonsil areas, and he had very difficult speaking, and it was going to close off his airway eventually if we didn't do something. So I actually injected the back of his tonsils, just open his mouth and inject them. And he's had probably 3 or 4 months ago, he's had some shrinkage in those tumors so far. We're tracking him, of course, monthly, and he's able to speak better and move more air easily. So it looks like we're moving him in the right direction. And he didn't want any chemotherapy or radiation. He just said flat out no. So very active guy. Wanted to keep him, give him an alternative. So I don't know if we'll need to do more on him. These are all early anecdotal cases, but there's great literature on this. Some of the early work was in animals where they would take malignant brain tumors, and some of those malignant brain tumors are crazy malignant. They just can't be controlled. They're not curable. And they would take some and implant some under the skin of a mouse. So they have this lump so you could see it. It wasn't hidden, in the skull. And then they took NK exosomes and they injected just through the skin into that mass, and they were able to get them to shrink away. So that's really what we're doing. When we talk about regular stem cell exosomes, I've been doing that for 7 years now, and we have incredible results especially with cartilage regeneration. We take people who are looking at joint replacements and pull them away from that brink and help them, improve and reverse osteoarthritis. Even if they're already bone on bone, even if their orthopedic surgeon said, hey, the next thing is a replacement, our goal is to put that replacement further down the list and hopefully avoid it. And there's great literature with 15-year follow-up on this. This is not new. It hasn't been in the US that long. The literature, most of the great literature is from Europe and a lot from Asia as well. And that's why 20 years ago, Tiger Woods and Peyton Manning and athletes would go to Europe for their stem cell type treatments. But the business end of stem cells, Jeff, are these stem cell derived signaling vesicles or exosomes. And they have advantages over stem cells in that they do the work of stem cells, but they are much more affordable because they're so much more abundant coming from amniotic fluid. And they travel through tissue better. They're easier to store and handle. And they have no reaction because they're naive and neutral. They're not a cell. They don't carry chromosomes and things like that.
Yeah, and for our listeners and viewers, again, going back to the kind of natural killer cells and the idea of them identifying what is foreign to the body, there are surface markers on certain cells that allow these cells to recognize that these are not normal to our bodies and they can be attacked. Whereas if it's a neutral surface, then nothing's going to be attacked.
Right. And that's why you can give someone any really exosomes in general, even NK exosomes or stem cell exosomes, and your body thinks you made them. It's like bioidentical hormones. They're identical to what your body makes. They have no serial number or barcode or identifying features otherwise.
So why are only a handful of labs able to concentrate NK cell exosomes, and how did you gain access to this cutting edge technology?
It's cutting edge too. I think you've got
you've Freudian slip there, huh?
It's just a lot of work. Again, you have to get the NK exosomes in abundance, which is difficult, and then you have to get them to survive in the flask and the petri dishes, and then have them produce exosomes and then concentrate those exosomes and identify, you have to test them and identify them. So it's just a lot of lab work. There are a bunch of labs that can do it, but to make them commercially available has been challenging. So we actually get them from Europe at this time. This will be a growing technique and more available. I think we're just one of the early adoptees here at ReCELLebrate.
Yeah, I think back to early growth hormone therapy, that it was really only available to individuals who absolutely needed it. People that didn't produce their own growth hormone, had forms of dwarfism and whatnot.
Right.
And of course, it was available in the black market, for the bodybuilders and stuff that really, could afford it and wanted to deprive somebody of something they really needed to survive and get bigger muscles. But now it has become so available. I mean, you can get it almost anywhere, and pretty easily. So do you anticipate that there's a timeline where that will occur for these exosomes?
I do. We're seeing that now with other peptides. I'm going to group growth hormone as a peptide because it's in that family. So, we're seeing the availability of peptides just blossom. They are not yet approved for marketing claims, but if you sit around and wait for marketing claim approval by a panel of people that are appointed by big pharma, then I'm sad for you.
And I think people need to understand too that there are so many different types of peptides. I was talking to a doctor recently, and he was saying how people just come in. I want to try a peptide, some peptides. Well, which ones? What for? Yeah. They're very, very specific in what they do.
That's true, and we are identifying more and more all the time. And just in case some listeners don't know what we're talking about, peptides are basically a small chain of amino acids. It's a subset of proteins. Proteins are all chains of amino acids, but usually 20 or so or less small fragments, which are more primitive molecules, do part of what a protein or enzyme would do by binding part of the receptor and triggering something in a strategic way. And some of our very primitive molecules that we make are peptides. For example, endorphin is a peptide, and that's it's the part of our own internal opioid system that makes us feel happy when we exercise. So we release these. I think endorphin might just be just a few amino acids and enkephalins and all these small hunger peptides and satiety peptides that make you feel full. And then you look at some strategic peptides on the market now, like the GLPs, which have been huge, not just for weight loss or insulin resistance, but we're using them for all kinds of anti-inflammatory and longevity hacks. So I personally have been on them for a number of years, and I'm at my high school weight, so it's not for weight loss anymore.
And I've heard that with GLP too, one of the side effects that they've discovered is that it really reduces some of the addictive behavior in the body.
Yeah. So one of it binds in the brain the impulse, the I'm satisfied area. It makes you feel satisfied, not just for food, but like you said, it spills over into gambling and other substances and things like that.
So how does NK cell exosome therapy compare to some of the other immunotherapies that are out there for cancer, like CAR-T, checkpoint inhibitors, and those types of things?
Yeah, I mean, the beauty of NK cell exosomes is it's off the shelf easy. Just inject it or put it in an IV. Whereas CAR T cells are very difficult, right? You have to take your white blood cells, separate out a T cell. You have to take a piece of the cancer and figure out what gene in the cancer cell is making something abnormally growing. You have to cut out that gene, insert it into the T cell so that the T cell is now genetically modified to produce that. And so it creates sort of an immune response and then put those back in the body. So hundreds of thousands of dollars per person, lots of lab work, lots of people involved, lots of steps, genetically modifying things. So not exactly natural, but okay. So it's a great technique, but it's certainly inefficient in producing it, at least.
And it would seem like the NK cell exosomes are a bit more non-specific, so you don't have to go through those steps of identifying exactly which gene you need.
Right.
You can literally just, whatever the cancer is, whatever the dysfunction is in the body or the abnormal cells, you just infuse it in there and it's going to recognize it and attack.
Yeah, and there have been publications showing that NK exosomes are tumoricidal, which means it kills cancer cells, in cell cultures for almost every type of cancer, from different neuroblastomas of brain down all the way to kidney and liver and all kinds of things. This you can look up on PubMed. It's not just me, a talking head on a podcast. It's out there. I wrote a summary article on this if anyone's interested, in a magazine called Lifespanning, and it's got all the references there on natural killer cell exosomes. So check that out. I think it's available online.
We can include that link in the description notes too.
We'll find it for you.
So what challenges still need to be addressed before this therapy becomes widely available?
Well, first and foremost, it's not yet covered by health insurance. So health insurers are now paying for PRP, platelet-rich plasma therapy, and that's not yet approved for marketing claims by the FDA. So the bean counters at the insurance company, they're only concerned about one thing and one thing only: profits. So they figured out that PRP is cheaper than surgery. So some intelligent first bean counter is going to figure out that if this natural killer cell treatment is working, that it's going to save not only dollars in the long run, a customer for longer, keeping someone alive for potentially a normal lifespan.
Yeah, that's a confusing thing for me with the insurance companies, is why do they not so quickly recognize that keeping their patients alive is more profitable for them than rejecting certain treatments or whatnot?
Because that's not part of the AI they're running to look at how to make money. The AI says optimize the income. It doesn't say optimize the outcome.
It's unfortunate. So where do you see NK cell exosome therapies fitting into the broader future of cancer treatment and regenerative medicine? I think you've probably addressed this a little bit, but
yeah. Well, listen, it's the kids use these text abbreviations, and there's one that if you know, IFY, whatever. So or IYF, YF, IYKYK, that's it. So if you know. So the people that seek this stuff know what they're looking for. The people that contact us for a consultation have some idea that they are trying, if possible, to avoid the chemotherapies and those things, or they're looking to do everything they can to add something so that they can be an outlier statistic, the one that goes 50 years, not 5 years in a survival chart. So they call and we talk it through. And if it's a reasonable option for them, understanding that we can't make any marketing claims, then we get it done.
What are costs like? So we know that, so many people are left in tremendous debt, even with good insurance when it comes to treating cancers and things like that. And so if an alternative is say, okay, this isn't covered by my insurance, but as an alternative, I'm more likely to live longer, have a better outcome and a more comfortable treatment sequence.
Yeah.
So I'm going to do it out of pocket.
Yeah.
What's that kind of look like for somebody?
Yeah. So luckily, we've got this, they're not cheap. I have to buy these and we keep them here in a minus 30°C freezer. So the average cost is under $10,000, for a dose. And then people that need more than one dose or something, we discount it, on the second and beyond. My current business model, I don't know if I'll keep this, is that we include all the consultations and visits as part of that. And then if those people have a health savings account or flexible spending account, they can use those. And without actually giving tax advice here, of course, you can write off medical expenses in excess of, I think it's 7.5% of your adjusted gross income. So, depending on your status, these are at least potential write-offs.
So it's not really out of the reach of many people.
No, and we don't want it to be. I mean, we could easily do that, but we don't want it to be. We want people to have access to this, just as I would want my family to have access to.
You obviously don't work for the pharmaceutical companies then.
I'm glad you noticed that. Thank you.
So how do you define aging well?
Well, it depends on the individual, right? Aging is a measure that is very personal. It's how you look, how you look on the inside and the outside, how you feel and how you function. And then there's the science side of it, right? If we do age-related biology tests, there are a few on the market that measure your biological age, not your chronological age, not your calendar age. Those are great measures. We also look at inflammatory markers. And if you focus on those biology markers, you're more likely to look good and feel good inside and out. And it takes work. You have to have a plan. And the earlier you instigate that plan and the more you do, the better your outcome. The slower you'll develop diseases, the less chance you'll develop diseases. Because if you think about it, most diseases of aging are diseases of inflammation. If you look at many of the theories of aging, it's really an accumulation of chronic inflammation at the cellular level. So all of these techniques work to combat the development and the accumulation.
That's interesting. We look at aging as being the accumulation of chronic inflammation, but we don't look at the ways that we can prevent that chronic inflammation. And there's so many things that we can do individually through diet, exercise, and so on to limit that inflammation, which in turn should limit our aging progression.
Right. And it's never too late to start, but the earlier you start, the better, right? So, and that involves all the major approaches. You're right. So exercise, diet, supplementation, aversion to certain things, right? Seed oils and other things in our diet, getting enough protein, restorative sleep, not just sleep, but restorative sleep. And that could require some techniques and things like that. Avoiding energies and stresses that cause oxidation, free radicals, and inflammation, like too many electromagnetic waves, toxins in our environment, pesticides, things in the food source, and then of course all the hormesis activities we mentioned earlier. Being strategic about stimulating your body to purge those zombie cells. So fasting, high intensity exercise, hot sauna, cold plunge, things like that.
And so that brings me to the question I ask of all of our guests. What are you doing personally to age well?
Well, thank you. I exercise strategically. So I am doing 3 days a week of Pilates, reformer Pilates, and 3 other days a week of very brief exercise. I do about 20 minutes of interval cardio. I usually get on the treadmill with a really good incline instead of doing 40 minutes flat. And I'll do fast, slow, usually 1 minute on and off. Then I do weights. I use the machines because I'm really not a bodybuilder, and I like to isolate the muscles. So I'll do machines, and I'll do 1 set to failure. I don't do 3 sets of 10 like I learned in high school. I'll do 1 set because failure is really where the money's made there, where the muscles are. And then on the 7th day, I do flexibility. I do a yoga class. I probably should do more of that. But that's what I do. And then during the day, I consume as much protein as I can. So for me to maintain, I probably need about 140 grams a day. So I'm drinking protein supplement drinks during the day, low calorie ones. And all my snacks are protein to the extent that we can, and when you're so full of protein, then you don't have room for carbs, you're not hungry for carbs. I take a lot of supplements. These are things I just never got in my diet. I don't get in my diet, and I need to have, and we could have a whole show just on that. I do, I'm a good sleeper, so I don't need a lot of help there, but I do take melatonin and magnesium at nighttime. I'm a big fan of those. Even if you go to sleep fine, melatonin will make you sleep deeper. You do your cellular repair at night. And we have a grounding mattress pad, so we try to take out the EMFs, and I don't sleep with my phone under my pillow. And we try to turn off the screens, 30 minutes before bedtime, and let our bodies know it's time to repair. I'm an intermittent faster to some extent, although I've noticed it's hard to get enough protein. So I will sometimes break that with a protein drink, a low-calorie protein drink. I do a 3-day fast every 6 months or so, water fast. And then I do, and I'm sure I'm missing some things here, but I also do regenerative medicine. So I do IV stem cell exosomes every few months. And I do that, for many reasons. That's one of the key things.
So it sounds like you're checking a lot of the boxes that we talk about on the podcast here. So
Good.
The sleep, the exercise, the diet,
yeah,
and then kind of fill in the holes where you're not able to hit those perfectly.
And everyone's got their own recipe, and that your lifestyle, what you can and can't do might vary. if you don't have access to all the gym equipment and stuff. But listen, I've got those really thick exercise bands that sometimes if I don't go to the gym, I'll use at home, and I can get a good workout with those. So you just have to, and you don't, you could get it from a trainer. You could also, there are great resources online. YouTube is full of workouts. You just find one you like, or more than one, so it doesn't get boring. And then there are all kinds of different things we do. So we do like planks on the vibration plate. I like planks. I like to work the transversus abdominis muscle, which is this one. It goes horizontal for those of you listening, and not just the rectus muscles. Everyone wants, six packs. So they do the crunches and the rectus, but you really have to, if you want to flatten your tummy, you got to work the transversus, and planks are a great way to work at that. So we do things like that. I like the vibration plate to move the lymph because you get clogged up. So we have an inexpensive one at home too. It's less than $100 online. So I like those little techniques. We just got this new bed now that has this big, I don't love the EMF, but it has a big speaker underneath the frame, and it'll give you like a 40 hertz, 30-minute vibration massage type thing. And man, that puts me right to sleep, like a rocking a baby.
Yeah, I did some early research on whole body vibration and different outcomes from it when I was at Hope College in Michigan. We had a really nice platform, and I got a platform when I moved out here to Oregon. But I think it was one of the football players when we had it down in the athletic training room for a particular study was playing on it and broke one of the dials, and I can't find a replacement part for it. So it's immobilized right now. So it's
yeah, I love those things. And you really work those little stabilizer muscles and things, which you need as we aged, to maintain balance and proprioception, so you don't get wobbly and fall down and break a hip, because sometimes that's all it takes. And
and you having some biomechanics background, probably fully understand this. That when I talk core to my students, I don't talk about just doing crunches or even like it goes from crunches to obliques. Nobody talks about transverse abdominis, like you said, but I talk the core basically that they call it the spiral line. It's the muscles that run from the occipital bone down, through the scaling muscles down to the rhomboids, through the serratus anterior, wrap around, goes all the way down to the base of the foot, and then kind of forms like a stirrup under the foot, and then comes back up, and then ultimately ends up on the opposite side, the opposite occipital bone. Mm-hmm. All those muscles and all that fascia is connected, and that's responsible for our posture and our ability to move properly. And we sit there and just do crunches. So when in your day do you really need that, strong trunk flexion? When you're hitting the snooze button in the morning is about the only time I ever really work those muscles.
Sometimes the remote is a little far for me, and I have to, I got you there. But no, you're right. And it's funny because I remember when I first saw a crunch, I was in college. I saw some people doing a crunch in the gym, and I thought, oh, that's cool. I'll start doing those. And for years I did them. And then as I learned about spinal biomechanics, I learned that if you do crunches, and that's your only core exercise, because so many doctors are busy and they say, oh, just work your core, your back will get better. People go, oh, okay, I'll do abs, and really, and this, of course, the core goes all the way around your midline, your midriff, and it's your own internal brace, but you got to build it, and it'll help your back. But if you only build the front of it, you're actually causing long-term asymmetric, biomechanical derangement to your spines that actually make the discs worse. So work the back first, and the paraspinals and the quadratus lumborums and all that in the back, in the lower back first and foremost, 3 times as much as you do your crunches, and definitely do your obliques, and the crunches can just be a little extra. And good old fashioned sit-ups, the way we did when Jeff, you and I were in elementary school, you put your feet under something and you just sit up. Those are probably better than crunches are if you want to have a showy six-pack,
Yeah, but, diet first for that.
Oh, yeah. If you want to see I get it. Yeah, abs are made in the kitchen for sure. For sure.
Well, you're obviously younger than me because you said back in high school doing 3 sets of repetitions, and I grew up in the 70s. And so I was in the Nautilus era, which was 1 set to failure. And I mean, we do workouts where we made the mistake once of biking to the gym we went to, which was probably about 8 miles from where I lived or more. And we biked there and just tore our legs up, and we had to bike home. And this is Pittsburgh, where it's up and down hills.
Yep.
My legs were so wobbly. I thought I was going to like fall into the road trying to bike my way home. But that's how we worked out. Now it's kind of gone to, there's so many different theories of how you should lift. And,
yeah.
When it comes down to what we teach is the basic practices through the American College of Sports Medicine, that's the stuff I teach my students. Okay, this is what you're going to need for that certification, but throw it out the door when we're done with class, because there's so much specificity that needs to go into that training.
Well, I didn't know Nautilus had a one set to failure sort of strategy. So that's great. I realized that the shape of the Nautilus machines it didn't give you a linear resistance, which I thought was brilliant, right? And when you look at some of the stretchy band stuff we do, you have a modified resistance at different parts of the length of your exercise, which is really great, because you think about bench press, for example. And people rest, when the bench is on their chest, and then it's hard, and then it's easy. Where at the stretchy bands, it actually gets harder the further you push it away. So it maintains a more constant time under tension, more constant tension. And you could tell me better. This is your field, but
we could do a whole episode on this.
Yeah, and it's great stuff, because this is how you can strategically in 20 minutes do a pretty good workout and hit a bunch of muscle groups. And get them good,
Yeah, I work out at home, so I have free weights at home. Really no machines, so I got to do the free weights. But it's a lot easier for me to do that than get to the gym.
Yeah, nothing wrong with it. But there was I didn't grow up too far from you, but we didn't have a Nautilus in my little town, so we had to
Where'd you grow up?
Western Ohio. So
what part of Western Ohio?
A little town called Lima.
I know Lima. Okay, that's a little bit closer to where I did my PhD, up at Toledo. Yeah.
Yeah. Okay.
Yeah. So, I have family from Wellsville, East Liverpool, which is the southern part of the state, closer to Pittsburgh. But
okay.
Yeah, I know Lima.
Yeah, salt of the earth, Midwest. No accent.
Yeah, that's truly God's country out there. Pennsylvania, Ohio, West Virginia. That's my area.
Yeah, good place. Of course, we all moved away to get warm.
I didn't really move away to get warm. I'm in Oregon just because my wife probably wanted to get warm and wet, and it rains too much here. I miss the winters.
Well, you don't have to go far where you are. Just go up to Mount Hood. You've got it.
Yeah, that's a nice thing. We're like an hour from the shore, hour from the mountains. We got everything we want right here. So where can our listeners learn more about your work? You mentioned an article. Any websites, social media, things like that we should alert the members to?
Thank you for that. So we call our practice ReCELLebrate, because we're celebrating the renewal of your cells, and that's spelled ReCELLebrate. And I think we're the only people using that word. So if you put that in your search browser, you'll find our website, which is ReCELLebrate.com. Our Instagram is @ReCELLebrate. Our YouTube I think has that name in it, and that's the easiest way to find us. We're all over the place there, and there are plenty of videos and lectures, and we do events. So if you want to come hear a lecture in person, we do a lot of health span events. We're doing one next month in Los Angeles. We're usually at the biohacking conference in Texas, where I'm presenting at the American College of Rehabilitative Medicine. If you go to that one, it's in Chicago next month, and we're sort of seeing the States, getting out there.
Yeah, I love what you're doing. And I can't wait to see it grow to the point where we see it almost all the time, where it's not something uncommon for somebody to go for their NK cell exosome therapy.
Thank you.
And just keep doing what you're doing, keep aging well, and keep helping people age well.
Thank you. Thanks for letting me help educate your audience and all the good work you do for putting this information out there so people can know there are alternatives.
Thank you for listening. I hope you benefited from today's podcast. And until next time, keep aging well.